Hi everyone, thank you so much for joining us today for this webinar entitled Health Equity Through Smoke-Free Multi-Unit Housing. Next slide, please. My name is Kyra Hill and I'm a staff attorney at the Public Health Law Center, and I'll be moderating today's webinar. Today's speaker is Andrew Twinamatsiko, who is the lead senior staff attorney for California Technical Assistance at the Public Health Law Center. Next slide, please. The Law and Policy Coordinating Center is a partnership between the Public Health Law Center and the American Lung Association to support tobacco control professionals in their work to end the commercial tobacco epidemic in California. The Law and Policy Coordinating Center provides free legal technical assistance to help communities pass strong local ordinances that are effective and legally sound. Next slide, please. We conduct legal research, develop policy, issue publications, and hold trainings and webinars like this one. We do not directly represent clients, nor do we lobby. Next slide. All of our work at the Public Health Law Center is grounded in health equity. This means ensuring everyone has access to the resources they need to ensure positive health outcomes. It also means eliminating barriers that infringe on fairness, human rights, and environmental justice. Addressing health equity requires confronting the social determinants of health. Today, we're here to talk about a key social determinant of health, housing. And with that, I'll turn it over to Andrew.
Thank you, Kyra, and thank you, Stephanie, and thank you all for joining us today to talk about this topic that is ever timely, and even as recent events have shown, we really need smoke-free multi-unit housing. So we are here to discuss different aspects of what smoke-free multi-unit housing entails. And before we go into that, I would like to lay out a roadmap of how this discussion is going to flow today. First off, we'll be talking about the health, legal, and economic reasons and benefits for smoke-free housing. And then we'll dig into smoke-free housing and health disparities, as Kyra already mentioned. We really try to focus on ensuring that we are delivering policies that engender health equity and not perpetuate disparities. And then we will talk about lessons learned from smoke-free housing laws, both on the national level and on the local level, specifically in California. And we also try to demystify concerns that people usually raise on, from a legal standpoint on smoking, that is discussing the question of whether there's a legal right to smoke, especially in the privacy of somebody's home. And then we'll also talk about legal risks of allowing smoking for those establishments and communities that don't have smoke-free housing laws, and how, in addition to the health consequences of permitting smoking in housing establishments, how that also presents legal risks. And then we'll finally talk about the salient components of a comprehensive smoke-free policy, so that when communities think about adopting smoke-free policies, they're able to have at least these components at the back of their mind to ensure that they are delivering the benefits of smoke-free housing in a comprehensive manner. So to start off, I would like to address the health aspects of smoking. We know that smoking is inimical to health. It is causally linked to different morbidities and mortality. And over the last decade or so, states and local governments and other entities have made significant steps trying to minimize the involuntary exposure to secondhand smoke. This has mainly been done through for public places and places of work. So although these steps to protect public health are laudable, many groups of people remain at risk of exposure to secondhand smoke. And this mainly happens in the home, and there are communities that don't have smoke-free policies. So the home is now one area where people continuously face the risk of exposure to secondhand smoke. As you may know, 14 years ago, whoa, that's been a long time, the US Surgeon General released a report entitled The Health Consequences of Involuntary Exposure to Secondhand Smoke, involuntary exposure to tobacco smoke. In the report, the Surgeon General concluded that there is no risk-free level of exposure to secondhand smoke. As I mentioned earlier, the report mentioned that secondhand smoke causes premature death and disease in children and adults who don't smoke. Children who are exposed to secondhand smoke are at an increased risk of sudden infant death syndrome, SIDS, acute respiratory infections, ear problems, and other severe respiratory injuries. And there is no way of protecting communities from secondhand smoke other than really eliminating smoke in areas. Cleaning the air or all of these separating smokers and non-smokers, that's not gonna work. The conclusion that the Surgeon General made was eliminating smoking in indoor places is the only sure way to protect non-smokers from exposure to secondhand smoke. And this conclusion has been reiterated by the American Society of Heating, Refrigeration, and Air Conditioning Engineers. And that association has also included smoke from aerosol from e-cigarettes and marijuana. So in addition to secondhand smoke, permitting smoking in housing establishments or any other establishment presents the dangers of third-hand smoke. Now, third-hand smoke is that tobacco pollution that persists in the air and on surfaces after smoking has stopped. This smoke sticks to and becomes embedded in materials such as drapes, carpets, furniture, children's toys, and this happens in areas where smoking occurs. Third-hand smoke produces chemicals that are emitted in the air, the same air that we breathe. And also people can get exposed to chemicals in third-hand smoke through contact with those surfaces. And this is especially presents a risk to children, toddlers who move from hand to go on to put everything in their mouths, or pets through licking their paws and things like that. So third-hand smoke presents an additional danger over and above second-hand smoke. So really, there is grave danger of permitting smoking in housing units especially. And the only sure way of eliminating those health dangers is to restrict smoking in those environments. But not just health. There are business benefits, economic benefits to adopting policies that restrict smoking in housing environments. Secondhand smoke causes damage to property and it requires periodic repairs. And because, of course, secondhand smoke cannot be contained in one unit, repairs have to be made even in those units where people don't smoke. A few years ago, folks from the UCLA did a study estimating the costs related to smoking multi-unit establishments in California, and found that the mean cost for smoking related repairs within the home was almost $5,000. Smoke-free properties, on the other hand, where they reached a mean of $1,866, which is a huge contrast of over $3,000 difference. So property owners have a lot to save by adopting and implementing smoke-free policies. Additionally, smoking is a fire hazard. Permitting smoking presents a grave risk of catastrophic fires. according to the most recent report by the National Fire Protections Association, it was done looking at years between 2012 and 2016. It was estimated that the annual average of 18,000 fires were caused by smoking. They killed 590 people, 590 people on average per year. They injured over 1,000 people per year and caused over 476 million in property damages. That's an annual average. So this is smoking not only presents health hazards, it also has economic consequences. So let's talk about another aspect of smoking that is really central to equity. Now we know that there are disparities in secondhand smoke exposure, and housing really bears out those disparities. A few years ago, folks from the CDC undertook a study that looked at publicly assisted housing and exposure to secondhand smoke. And it really drew glaring disparities in terms of the rate of smoking and individual exposure to tobacco smoke. It's estimated that a quarter of the US population uses multi-unit housing as their source of housing. 7 million of those live in publicly assisted or publicly subsidized housing. And according to that study, 33.6% of hard-assisted adults smoke cigarettes. That study was taken at the time when the smoking rate in the United States was, I believe, on the national level was still at 15%, and that doubled the national rate. And the interesting fact is that there was a great deal of smoking, not just the frequency of it, but the amount of smoking that happened. 80% of the smokers under that study smoked, 80% of the smokers smoked daily, with 70% smoking more than 10 cigarettes per day. And this is a product of, as we know, of industry targeting particular groups of people of low socioeconomic status, racial and sexual minorities, and other marginalized groups of people. And also, due to other certain determinants of health, there is a disproportionate use of tobacco products, especially smoking, within these populations. And these populations end up finding their housing options are limited, and they are overrepresented in multi-unit housing establishments. So couple those statistics with the fact that we spend approximately 69% of our time in our homes. And then all that tied in with the health hazards that I highlighted above that talk about exposure to secondhand smoke, the causal relation between smoke and heart disease and lung cancer, and sudden infant death syndrome, and all other ailments. And you realize that people whose housing choices are limited to multi-unit housing disproportionately bear the burdens that are associated, the health burdens that are associated with tobacco use. And that is a health inequity that should be corrected, and we should be intentional in making policies that focus on those particular social determinants of health. As Kyra mentioned, housing is a social determinant of health, and in order to address health disparities, we have to tackle social determinants of health. And that's why multi-unit housing is really indispensable in our journey to achieving health equity and in achieving health equity and minimizing health disparities. And these disparities aren't really aren't just a national representation. California has its own fair share of disparities. And this was a study that was done by, there's statistics from a study that was undertaken by some folks, and I've given the citation of the study here, feel free to look at it. But the study shows that at the time it was undertaken, the statistics showed that 32% of Californians live in multi-unit housing. There is, just like on the national level, the disproportionate overrepresentation of demographics mentioned under the CDC study that I shared above are also present in California. According to this study, 63% of multi-unit housing residents were racial minorities, as opposed to minorities in single-family homes that constituted 49.6%. Additionally, 46.8% were people who were on the lower end of the socioeconomic status. And then 21% of those individuals had low academic attainment with no high school diploma. Contrast that with people who live in single family homes who are only, it's only 14.8% who do not have a high school diploma. Also, another aspect that bears out the marginalization of people who live in multi-unit housing. 23.4% were uninsured, as opposed to 14% of individuals in single family homes who are with health insurance. And then, although the statistics differ from the national ones, this study showed that adults living in multi-unit housing were more likely to be current smokers than those living in single family homes. The smoking rate in multi-unit housing at that time was 17.5%, and the one in single family homes was 13.2%. So again, in California, people who live in multi-unit housing disproportionately bear the burdens associated with exposure secondhand smoke. And so with that, I really wanted to also talk about what we are all experiencing globally and how the urgency of our work in smoke-free multi-unit housing should also be emphasized. These are statistics from, I think they represent numbers from a day before yesterday, from the 26th, and it shows that that 43,464, there's been that's the number of confirmed COVID cases in California. The green part is that there's been 1,755 deaths associated with COVID. And governmental entities are taking measures to mitigate the effects of COVID, including requiring individuals to stay at home. And guess what? We're spending more time at home with us. So the intersection of COVID and exposure secondhand smoke create a complication with particular groups of people, especially in light of what we talked about when the people are staying at home and there is a very, very great risk of exposure to secondhand smoke. And this is not some fantasy conjured up. There are studies that show the association between COVID-19 and smoking. And the folks at the Nicotine and Cannabis Policy Center at UC Merced earlier this month did a study that really showed how people who are exposed to chronic secondhand smoke are vulnerable to COVID. So the study showed three distinct ways through which the vulnerability to COVID-19 is exacerbated by smoking and exposure to secondhand smoke. Particularly, they noted that smoking is immunosuppressive and increases one's susceptibility to respiratory diseases. Because smoking, of course, affects the body's immune system, it impairs its ability to fight back against foreign elements or the virus like COVID-19 if they invade the body. So suppression of the immune system. And I'm not going to get into the science of it. The study can be accessed at the NCPC website, so feel free to go read it. But I want to highlight some of the things. Also, the fact that exposure to nicotine increases enzyme receptors onto which the COVID virus binds and then enters the human body. And then, of course, it increases the severity of COVID-19 symptoms, especially in people who smoke. So these are really dire statistics and things to know in order to have it in the back of our mind when we're thinking about smoke-free multi-unit housing policies, and especially how they affect people during this time. So the report made two recommendations: strengthen smoke-free laws that relate to secondhand smoking exposure, especially in light of the stay-at-home orders that we know is in place in California. And also, it recommended that people provide cessation services, including NRTs, for individuals so that they aren't really at a higher risk of contracting COVID related to tobacco. And so adopting smoke-free policies is an unprecedented phenomenon. And in fact, we know that at least even on the national level, the federal government under the Department of Housing and Urban Development has required a certain segment of publicly assisted housing to go smoke-free. Those are public health agencies. And I would like really to take you through the timeline, the journey through which HUD went before it fully implemented, it fully required PHA's, public housing agencies, to adopt smoke-free policies. So in 2009, HUD started strongly encouraging entities receiving public assistance to go smoke-free. And some PHAs did. In fact, over 600 PHAs adopted some sort of smoke-free multi-unit housing policy on at least one of their properties. And then between 2012 and 2014, HUD was issuing toolkits for effective implementation and enforcement of smoke-free policies. And then it requested comments in order to assist individuals that PHAs and owners who are ready to go smoke-free to give information to help them implement smoke-free policies. And in 2015, HUD proposed a rule requiring PHAs to adopt a smoke-free policy. The rule was finalized in 2016, and it got fully implemented in 2018. But the trajectory, and this is great. I mean, we have a group of people whose housing resources is limited to publicly funded housing. And it's great that our governments are intentional about protecting these populations from the negative health outcomes associated with exposure to secondhand smoke. But if you look at this timeline and the process that HUD took, you realize how there could be inequities in adopting smoke-free policies. First, the voluntary encouragement, instead of requiring every PHA or every publicly assisted establishment to go smoke-free, it was to be done on a voluntary basis. And of course, because smoke-free policies, the most benefits accrue to the residents, not the property owners. Property owners may be a little reticent to adopt smoke-free policies. And we saw that between 2009 and 2014, when HUD was allowing PHAs to just go smoke-free on a voluntary basis. Not everybody became beneficiary of smoke-free housing, and those smoke-free housing properties were scattered all over the country, with a huge concentration in the West and in the Pacific West and in the Northeast of the United States. So that left a whole lot of communities behind. But we have now a segment of publicly assisted housing, which are defined as public housing agencies under federal law, that are required to go smoke-free. And so I'm going to go through the components, just briefly go through the components of that rule, and just give you a brief overview of what it entails. Excuse me. So the law, the HUD rule applies to PHAs, which are publicly owned housing establishments, which enter into contracts with HUD to provide housing to particular groups of people. The HUD rule prohibits smoking tobacco products, which are products that involve the ignition and burning of tobacco leaves. So cigars, cigarettes, pipes, and water pipes, hookah. And then it also restricts smoking within indoor areas, including individual units, common areas, hallways, offices, and maintenance places, things like that. And that's great. Also, it restricts smoking in outdoor areas of PHAs and areas where smoking is prohibited, which is great, because, and that's like within, it restricts, the restriction applies to within 25 feet from indoor areas where smoking is prohibited. And this is not some random number, actually. Like the 25-foot barrier is informed by scientific studies that have shown that smoke from tobacco reaches background levels between 20 and 23 feet from the source. And so 25 feet is a safe distance for tobacco smoke emanating from tobacco smoke emanating from a particular source that lies that distance away. And of course, you can't grandfather in somebody just because somebody has lived in a unit and they smoke. They can't continue smoking just because they've always lived there. And these are just the minimum requirements. PHAs can go all the way and restrict smoking entirely on the property. As I noted, the HUD rule only applies to tobacco products that involve burning or igniting of tobacco leaves, which doesn't include e-cigarettes, and you can include that. And there were implementation processes built in place. HUD has implementation processes for new programs, which include what they call amending their plans, PHA plans. It's an elaborate process that involves conversations with resident advisory boards and community stakeholders, which is a really great way of adopting and implementing smoke-free policies, because really the huge lesson that's been learned from individuals that have adopted smoke-free policies is that community buy-in is really central. So involving people in conversations at the earliest stage and thinking about smoke-free policies will yield a lot of returns in the long run. And HUD required also that its smoke-free policy be enforced through the lease process, which individuals had to go through lease amendment processes or had to be adopted through rule changes in different communities. And so smoke-free policy, and we know that there are various communities in California that have gone smoke-free. And so there is no real legal impediment from governments, including the federal government. Actually, when HUD adopted a rule, there was a lobbying organization called New York City Clash, which is New York City citizens lobbying against smoke harassment, sued HUD, saying that the HUD smoke-free rule was unconstitutional. It laid out a litany of grounds, including violating the Fourth Amendment and other rights of privacy that are constitutionally protected. And the U.S. District Court for the District of Columbia said that upheld the HUD rule. So smoke-free housing is pretty legitimate, and governments have all the power to do that, to protect people from the effects of secondhand smoke and exposure to it. Typically, when I have conversations with individuals about smoke-free multi-unit housing or smoking in housing establishment for that matter, there was one abiding question that shows up. Well, how can you, don't people have a right to smoke? Smoking is a legal activity in the privacy of their own homes. And I've had this question be asked to me by a senior attorney that I know who doesn't believe who believes that there's some type of constitutional protection for people to smoke in their homes. But like I said, that question was settled recently by the court, by the federal court upholding the HUD rule. But let's talk about this in a little more detail, because if you are going to talk about a right, most rights are enumerated, and there is nothing in the United States Constitution or in the California Constitution for that matter that prescribes a right to smoke. Well, you could say, well, Andrew, the Constitution doesn't really say you have a right to marry or the right to contraceptives, but we know that those are constitutionally protected rights, and you'd be right. A lot of people, there've been a lot of cases that have argued that, asking for smoking to be, at least as some right of privacy that's protected. And every case that has been litigated in that ground no case has established that there's a right to smoke. So smoke-free policies are legit and can be upheld. And there are other arguments that are made, that smoking is, restricting smoking is discriminatory, discriminates against people who smoke, and people have a right to smoke. But that argument hasn't really held up in when it has been litigated. Although the Constitution, I like to say this, I usually, you'd be hard pressed to find any regulation that isn't discriminatory. By and large, every law is discriminatory. For example, you can say, oh, the laws that require people to have driver's license discriminate against people who can't drive. Well, but yeah, there's reasons for it. And so it's the same thing with equal protection laws, especially if they don't involve fundamental rights or what they call suspect classifications like race, like alienage, and sometimes gender. And so those classes are limited. And so smokers aren't a protected, they aren't a protected class, are protected by the equal protection clause of the 14th Amendment of the California Constitution. On the flip side, though, there is such thing as hypersensitivity to smoke, which is a recognized disability under American disability laws and fair housing laws, and requires that individuals whose physical ailments are exacerbated by exposure to smoke are entitled to reasonable accommodation so that they can live within their home. So if an individual has that disability, they can actually require that they be given a reasonable accommodation so they can continue living. And then, of course, in addition to that, California law has come out and said, told landlords they can prohibit smoke-free, they can adopt smoke-free policies by prohibiting smoking of tobacco in their buildings, and this has to be implemented through a lease. As I mentioned before, there are legal risks that follow not adopting a smoke-free policy. So, and these are some of them, and I'll go through them quickly. There is, when a property owner leases property, they guarantee that that property is fit for human habitation. It's called the warranty of habitability. But we know that smoking, of course, there's no risk-free level of exposure to secondhand smoke, and I can't really emphasize that because it's this air that will kill you. It's this air that gets into your home that will kill you. So you landlords potentially risk violating that warranty of habitability if they don't adopt smoke-free policy, or the warranty of quiet enjoyment. Like when a property owner leases their property, they surrender one of those sticks in the bundle of rights of possession. You give your possession of your property to somebody else and guarantee that you'll not interfere in their enjoyment of that property. But by allowing smoking within that environment that interferes with somebody's enjoyment of the property, you are violating potentially the warranty of quiet enjoyment. And I talked about disability discrimination on the hypersensitivity to smoking can be a nuisance. There are other theories in trespass and negligence. So there's a whole host of issues that follow permitting smoking within a community, and these are serious legal risks that people assume when they don't implement smoke-free policies within their housing establishments. And so with that being said, let's talk about how to go about what the salient components of a smoke-free housing policy might be. You have to have a comprehensive definition of smoking. And mainly, we've talked about tobacco and the carcinogenic matter in tobacco smoke, and cannabis smoke too has carcinogens that are known to has elements that are known to cause cancer, and e-cigarettes as well. They have all these, they present levels of air pollution that aren't acceptable, and adopting smoke-free policies that are comprehensive, that encompass all those elements, will be the sure way to guard against the health, legal, and the economic aspects of smoke-free housing that I've talked about. And in fact, in California, California law requires that the restriction of smoking cannabis in all places where tobacco smoking is prohibited. So you can't really, a governmental entity, when it adopts a smoke-free policy, it can't exempt cannabis because state law mandates that. And another aspect is that to be comprehensive, a smoke-free policy has to cover all multi-unit housing establishments, not just apartments, but also common interest communities like condominiums or HOAs and all that. And the reason why I emphasize that is that you are living in a community where there is shared air, and the risk of air traveling from one place to another is readily apparent. And that air, which if smoke is permitted, will bear with it particulate matter that is causally linked to all these ailments that we mentioned that the Surgeon General has warned us against and the public health experts. And so that's why you don't want to leave any community behind. And that would also be a serious equity issue. Just because common interest communities aren't renting, they shouldn't be left behind because there are people who are stuck in those communities and they can't just up and leave just because they own their community, they own their homes. Then additionally, smoke-free multi-unit housing policies have to cover all those individual units, including balconies and patios, because doing anything short of this continues to present risks of exposure to secondhand smoke, because we mentioned how what it takes for tobacco smoke to reach background levels where it might not be as harmful. And then, of course, that goes without saying that common indoor areas have to be also encompassed in the smoke-free housing policy. And then common outdoor areas, all these areas that present a risk of exposure to secondhand smoke by other individuals, they have to be included. And then I also I would also like to talk about designated smoking areas. And those, I put in this slide, you'll note that I put an asterisk on top of prohibits designated smoking areas. Designated smoking areas, one, they have negative health consequences as establishments. For one thing, they present the same risk of danger to expose secondhand smoke if there is a concentration of individuals in those areas. And two, they continue to present issues with pollution of where cigarette butts are littered and things like that. And then, of course, three, it normalizes smoking. And if the end goal is to restrict smoking within to prevent the consequence of smoke within environment, then we will continue normalizing smoking with that environment if there is a designated smoking area for a particular. But I know this is, I'm aware of communities, how they have to balance different competing interests, and this is something that they can take on their own, but I wanted to present the reasons why designated smoking areas might not necessarily be a good idea, and they might not necessarily get you to how you might want to be comprehensive in your smoke-free multi-unit housing policy to achieve the health benefits that we talked about. Then there's typically people worry about the implementation and enforcement of smoke-free multi-unit housing policies, and they should be. And as I mentioned, one of the lessons from HUD and other communities that have adopted smoke-free housing policies is that community buy-in is really a big deal. Education is important. It should be like if a community takes on ownership of a policy and they realize it's in their best interest to adopt a community that is in their best interest, that will lead to success in implementation and enforcement. So that's why you have to, in thinking about smoking policy, you have to engage advocacy groups and communities that deal with a great deal of education, and create a time period when that can happen that is realistic. And then it's kind of hard when you're trying to talk about implementation and enforcement plans from legislative standpoint, from, let's say, a law that is adopted on a county or city level vis-a-vis individual community level. So in thinking about policies that are adopted as an ordinance on a county or city level, there is a whole host of mechanisms that what should be uppermost on lawmakers' minds should be how can they build in mechanisms to ensure community buy-in and enforcement that is going to not negatively affect people who are already beset by other sort of determinants of health. For the most part, smoke-free policies are self-enforcing. That's mean once you adopt a smoke-free policy, it becomes the rule. And the exception will be the violation. And so those are just cases that you'll be dealing with here and there, but the rule will be. And so signage is important, which becomes part of educating the community that smoking is prohibited. And then also ensuring that there is mechanisms to guard against penalties that exacerbate health disparities, including eviction. Eviction should be the last of resorts. Or think about things, the enforcement mechanisms that affect people's finances, and how do those affect those communities. They're different enforcement mechanisms that could be adopted, but you have to think through those in order to ensure that you're guarding against the inequities that attend multi-unit housing. Then grandfathering in, people who have been in the community for a while, and then you adopt a smoke-free policy, what happens to them? There's no legal or health reason for doing this, and really, like, grandfathering, why do it in the first place? Because you maintain the status quo. So if you adopt a smoke-free policy or smoke-free ordinance and you grandfather existing smokers, it will the health problems we're trying to address will continue to persist, and that will be like you're not really accomplishing anything. And then there's, of course, the main mechanism, which even HUD used for enforcing smoke-free policies, is through lease agreements. But you typically hear of recalcitrant property owners who don't want to really take on the responsibility of ensuring that the communities are protected from tobacco and other restricted products. So including a way through which private individuals can take on action and also maybe hold property owners accountable to some governmental entity, because there are already existing mechanisms in landlord and tenant relationships that are mandated by public law, local state law, through which property owners have to meet particular standards. And if they're not complying, there can be public enforcement action against that recalcitrance. And then one way of ensuring that individuals get to, if property owners are dragging their feet, one way of ensuring that individuals is find a way of easily finding alternative enforcement remedies is to declare secondhand smoke a nuisance. Nuisance is a really interesting area of the law, and you have, if the traditional nuisance idea is that if you if you are intruding in somebody's enjoyment of their property in a substantial manner, then you're creating a nuisance, even if you're doing illegal activity. And the courts that have looked at cases that say smoking is a nuisance haven't really engaged with the science of secondhand exposure to smoke, and they put a huge burden on individuals to prove damage. But we know that even a single incident of exposure to secondhand smoke, per the Surgeon General, is inimical to your health, and the courts haven't caught up with that remedy. So one way of addressing that is for localities to come out, and cities or counties to come out and say, an instance of exported secondhand smoke, because we know it's inimical to health, is a nuisance, and thereby alleviating the burden of proof that would be on individuals to prove that secondhand smoke is a nuisance. Yes, so like Kyra said, we provide free technical legal assistance on issues that relate to tobacco control and ending the tobacco epidemic. And here's our contact. The information is free. So if you have any questions regarding a policy that you're thinking about, or a policy that you might want to be tweaked, or different options, please feel free to reach out to us. We're happy to talk to you, and I'll give you all the information that you need. Thank you.
Thank you so much, Andrew. So with that, we do have a little bit of time for questions. I'm seeing a few questions about cannabis. So first of all, can you talk a little bit about enforcement and policy language that includes marijuana?
Well, thank you, Kyra, and thank you for asking that question. And I think, yeah, this is an interesting question, and there's a lot of people who are concerned because, unlike tobacco that doesn't have any medicinal virtue, marijuana, as California law suggests, as approved by California law, is medicinal, and people take it to address ailments. But we also know that it presents public health harms. And so how do you balance that, especially in a situation where you're living in a community where there's shared air? So for one thing, as I mentioned before, if a government is to adopt a smoke-free policy, state law requires that cannabis be included. So there's no way to go about that. And also, there are other ways. It's the smoke-free policies really don't tell people they can't smoke. They just regulate areas where activities can happen. And so either that could be smoked off the premises, or it could be administered in any other ways that don't present health harms, for example, secondhand cannabis smoke to other individuals.
So just to clarify that, medical marijuana can't be treated differently than other types of marijuana?
No, it can't be. There's no distinction. California law doesn't make any distinction, at least as far as smoking is concerned, where tobacco smoke is prohibited. It doesn't make a distinction between whether smoking is being done for medicinal or recreational purposes.
Great, thank you. We have a few questions about examples of enforcement techniques or equitable enforcement ideas that don't further contribute to inequities.
Yeah.
A long answer, but maybe you can help us.
Yeah, thank you for that question. And yes, that is really great, because most communities, what they do is to, and this is also from HUD, like the recommendation that was made, most communities have required graduated enforcement, and also connecting the graduated enforcement to referral to cessation services and connecting them in a meaningful sense. And always the fear that people have, that we've always seen, is that restricting smoking is going to lead to massive evictions. But as I mentioned, this should not be a remedy of first resort. There should be empathy in terms of realizing that smoking is an addiction, and people are not just going to quit one day. But also, for example, some communities give warnings to begin with, and depending on how it fits within the community, maybe some type of monetary penalty that's not prohibitive, because that will exacerbate disparities. But if a gradual mechanism is put in place, and the National Housing Law Project has put out a publication that addresses equitable enforcement of smoke-free policies, and it highlights some ways through which communities have developed graduated enforcement mechanisms so that people are given a chance to comply with policies, but also ensuring stability within the housing system.
Great, thanks. I think we have time for maybe one or two more questions. Someone did ask about whether or not trailer homes could be regulated by a smoke-free multi-unit housing law.
Yeah, great question. I mean, I think it depends on your definition of what you want to regulate. Generally speaking, communities, local governments have what we call police power to protect their communities from, to protect the community's safety and health and public health. And if a city, for example, determines that there are risks of, for example, fire or shared air that I've mentioned before that are equally applicable to trailer homes, then they can extend their definition of smoke-free house, or their definition of multi-unit housing to encompass those communities, or just define them in a way and regulate how what activity is permissible in those communities. But yes, generally speaking, a city in adopting an ordinance can expand their definition of what entities are covered to include homes like that.
Great. Well, it looks like we're pretty much out of time. We did get a bunch of questions that we'll try our best to answer offline when this is over. As Stephanie said at the beginning, this will be available on our website within 24 hours, along with the slides that Andrew presented. And you have our contact info there in case you want to follow up with questions after the webinar. So thank you very much for listening.